Good afternoon, folks. This afternoon's topic, the title is The Great Global Caregiving Crisis. Okay, here we're going to go through that for A. So please join me for today's A presentation. Here we go. The Great Global Caregiving Crisis. A perfect storm of demographic change, workforce collapses, and policy neglect is reshaping how the world cares for older adults, and the effects are already visible in countries like our communities like Meadville, as populations age and care needs intensify. The systems meant to support older adults are straining under pressure they were never designed to withstand. without bold action, the gap between what families need and what systems can provide will widen dramatically. At its core, this crisis is about who will care, how and at what cost, financially, emotionally, and socially. Why this is happening and why it's accelerating. One, a demographic shift with no historical precedent, access constraints. Societies are aging at speeds that outpace their ability to adapt. People are living longer with conditions like dementia, heart disease, and mobility limitations that require daily support. Meanwhile, fertility rates have fallen below replacement levels in most high-income countries. This creates an intertwined population pyramid. More elders than ever before. Fewer work-age adults to provide paid or unpaid care. Shrinking family sizes, meaning fewer adult children to share responsibilities. This is not a temporary imbalance, it's a structural transformation to a collapsing care workforce. Direct care workers, home health aides, personal care aides, nursing assistants from the backbone of long-term care, yet globally, these workers face low wages, limited benefits, high injury rates, minimal career advancements, emotional exhaustion. Many leave for retail or service jobs that pay more with less physical strain. Rural regions like northwestern Pennsylvania feel this most adequately. Agencies can't hire fast enough, and families wait weeks or months for help. 3, policy systems that never caught up. The most counties built, most countries built healthcare systems for acute illness, not long-term support. As a result, long-term care is a patchwork of family caregiving, underfunded Medicaid programs, private pay, home care and assisted living, volunteer networks, faith-based or community supports. This patchwork worked barely when families were larger and elders lived shorter lives. It's now unraveling for COVID-19 exposed and accelerated this crisis. The pandemic did create the crisis, but it magnified every fault line. Workers left the field in droves. Facilities struggled with staffing and safety. Families absorbed more care as services shut down. Hospital systems became clogged with patients who had nowhere else to discharge to. The aftershocks continue today. Who feels the impact and how older adults reduced access to consistent high quality care, higher out-of-pocket costs, increased risk of hospitalization, falls, and preventable complications. Create greater likelihood of institutionalization. When home care fails, family caregivers. Family caregivers are the invisible infrastructure holding the system together. They face chronic stress, depression, and burnout, lost wages, or forced early retirement, strained relationships, physical health decline. A sense of being overwhelmed and unseen. Globally, unpaid caregivers provide billions of hours of labor that would otherwise bankrupt healthcare systems, communities, and health systems. Hospitals struggle with bed blocking when patients can't be safely discharged. Employers lose productivity as workers juggle care. Medicaid budgets balloon. Rural communities face service deserts. This is not just a healthcare issue, it's an economic and workforce issue. Quick decision guide. Families, employers, and policymakers. Families begin planning early before a crisis forces rush decisions. Use respite care, adult day programs, and home care agencies to prevent burnouts. Reassess needs monthly. Dementia and chronic illness evolve quickly. Document preferences, power of attorneys, and care plans. Employers offer flexible scheduling and caregiver leave. Provide resources, lists, or EAP referrals. Recognize caregiving as a workforce issue, not a personal problem. Policymakers raise wages and create career ladders for direct care workers. Expand home and community based services. Build sustainable long-term care financing models. Support family caregivers with stipends, tax credits, and paid leave. Comprehensive snapshots, causes, impacts, and solutions. Aging population, surging demand for long-term care. Expand public long-term care financing, invest in home-based care. Low caregiver pay, worker shortages and turnover. Raise wages, create training pipelines, offer benefits. Reliance on on family caregivers, burnout, financial strain, paid family leave, respite programs, caregiver stipends, fragmented systems, inequity, insufficiency, integrated long-term care models, coordinated care teams, risks, trade-offs, and implementation challenges, cost versus coverage. Expanding public care is expensive. Sustainability will equally with equity. Quality versus speed. Rapid workforce expansion without training risks poor care and safety issues. Equity concerns. Market-driven solutions often leave low-income families behind. Okay, guys, that is your A for today. I will be back on shortly with B. Give me a little bit to put that together for you, and I'll be back on with that for you. For now, Gator Wellness. Take care, folks.